ADHD is a neurodevelopmental disorder. The symptoms occur very early on in life, typically from kind of age 2 to 3, and then they start to emerge once you get to school age more obviously. ADHD itself is actually an umbrella term for 3 different disorders really. The first of which is a symptom cluster predominantly related to inattentive symptoms. So that's difficulty with remaining focused on a task, so difficulty with sustained attention and concentration, propensity for daydreaming, difficulty with organising day-to-day tasks. The other arm of ADHD is that of impulsivity and hyperactivity. Those symptoms can differ from childhood into adolescence and into adulthood, particularly in children and adolescents, is that of having a lot of energy or feeling like there's a motor in them and they don't know where to put all the energy. And the impulsivity can result in a number of issues, including difficulty with talking on top of people, interrupting others, difficulty with turn taking, and often blurting things out without thinking through them and then regretting it. We have some theories behind why some of these things might be happening, and that includes problems with the frontal lobe and prefrontal cortex. It's suspected that there's an imbalance of some of the neurotransmitters, specifically dopamine and noradrenaline, particularly in affecting that frontal lobe and prefrontal neurocircuitry. About 50% of young people will grow out of ADHD, and part of the argument for that, it's suspected, is that actually some of the problems in the subcortical areas of the frontal lobe actually resolve, but the prefrontal cortex dysfunction continues, and that's what is behind some of the differences in the symptoms in adult ADHD versus childhood and adolescent ADHD. In terms of the differences in symptoms from child and adolescent presentations of ADHD, particularly within, for example, the impulsive hyperactive symptom domain into adulthood, is that while those hyperactive impulsive symptoms may manifest as not being able to sit still, running around impulsively, not getting up in class at the wrong time or in a meeting at the wrong time, that tends to present more in terms of impulsivity in adulthood. So for example, not being able to turn take, talking on top of their partner, talking on top of their boss, and understandably that's going to create different types of problems as an adult. The process of getting diagnosed with ADHD often starts with a few red flags being brought up by a teacher or a partner or a parent, or initially with the GP. Assessment can involve questionnaires that can screen for symptoms, but there's no questionnaire that actually formally diagnoses on its own without clinical assessment. And that clinical assessment typically begins in a GP office that will then refer to either a psychologist, neuropsychologist, or psychiatrist or paediatrician. One of the important things in terms of diagnosing ADHD, and particularly in young adults or adults, is that we need to establish the presence of the symptoms prior to the age of 12. And that can sometimes be a bit difficult in terms of recollection for that person, so we often involve corroborative information from school report cards and also from parents or carers. Once you've got an established diagnosis of ADHD, there are a number of treatment pathways that are available, one of which is medication-based, and then there are also non-medication-based treatments, which include behavioural and psychological therapies. We have a huge amount of evidence to support the use of psychotropic medication in the treatment of ADHD, and that still remains the first-line treatment option together with psychological or behavioural therapies. Stimulant therapies demonstrated to have extremely high response rates. Over 80 to 90% of young people and adults will respond to stimulant therapy, and that includes across the inattentive and hyperactive symptom domains. The most common side effect is appetite suppression, and that can be associated with some nausea, belly upset. That happens in around 10 to 20% of people initially when they start it. It can also cause a bit of jitteriness in some people. The medications as stimulants can actually disrupt sleep. However, with careful titration and taking them earlier on in the day, it reduces that impact on sleep phase delay. While there's some early evidence that there might be a slight over-diagnosis in some population groups in the United States, The evidence in Australia is actually the reverse. So what we know is that 6% of the population in children and adolescents will have ADHD, but currently under 2% are receiving treatment. So that means about only 1 in 4 young people are actually receiving the treatment that they need for ADHD. And what's concerning is that we know that if we don't treat ADHD, that increases the rates of a number of adult disorders, worsens their developmental trajectory in terms of educational outcomes, in terms of work outcomes. It can increase rates of substance use problems. It can increase rates of relational problems into adulthood. There is not an increasing prevalence of ADHD, but I think there is better access to diagnosis and treatment.